Okay, let's get started. Hi, everybody. This is Marcy Darnofsky. I'm the Executive Director here at the Center for Genetics and Society, and I want to welcome you today to our Talking Biopolitics conversation. We're going to be talking today with Corey Johnson and Alexandra Minna about 20th century and 21st century sterilization abuses here in our state of California. This is a part of our Talking Biopolitics series, which is our series of web-based conversations with authors and thinkers um, who have written and are thinking about issues around biopolitics, the new biopolitics, human genetic and reproductive technologies. So we'll be starting by talking with Alex and Corey, and after that we'll be bringing some of your questions and comments into the conversation. But before we get started, I have a few announcements that I do want to make to you about the event and about the Center for Genetics and Society. So let me start by telling you that we at this point have a number of Talking Biopolitics conversations recorded and available online to you. So this year, we've talked in our series with Miriam Zoll about her new book, Cracked Open, which is about the fertility industry and misleading information that many people receive about it. We have talked with George Estreich, who wrote a wonderful memoir of life with his daughter Laura, who has Down syndrome, called The Shape of the Eye. We have a recording of our conversation with Ruha Benjamin about her book, People, Science, Bodies and Rights on the Stem Cell Frontier. Also, Donna Dickinson, her book is called Me Medicine versus We Medicine, Reclaiming Biotechnology for the Common Good, about the claims about personalized medicine. And finally, last month we talked with Regan Brashear and showed clips from her new documentary, Fixed, the Science/Fiction of Human Enhancement. So all that is online. Those were our Talking Biopolitics webinars this year. And in 2012, we talked with Bill McKibben, who you probably heard about as a wonderful climate change activist. He also wrote a book about human genetic modification called Enough, Staying Human in an Engineered Age. And we talked with Dorothy Roberts, who I'm happy to say is one of the advisory board members of the Center for Genetics and Society. Her book is Fatal Invention, Science, Politics, and Big Business: How Science, Politics, and Big Business Recreate Race in the 21st Century. And we talked with Harriet Washington about her important book, Deadly Monopolies: The Shocking Corporate Takeover of Life Itself and the Consequences for Your Health and Our Medical Future. So I should tell you that all the links that you see on these slides are live if you want to bookmark them right now, but we'll also be sending them to you in an email after this conversation. So you'll have them and can view these recordings, share them with your friends and colleagues. Let's see. Talking biopolitics is part of our efforts to really build a new field of scholarship and of advocacy that looks at these issues from a perspective that's grounded in social justice and human rights. So that's really what we're about here at the Center for Genetics and Society. Today, as I said, and I'll repeat because a number of people have just joined us, that we'll structure this conversation by beginning with, after a few announcements, with some questions that I have for Alex and Corey, some questions that they have for each other. And after about a half an hour of us talking, the presenters talking, we'll bring your questions into the conversation. Now, at any time, including right now, you can submit your comments or questions by typing them into the Q&A box that you see at the bottom of your screen there. And we'll be, tracking those and bringing them into the conversation later. I also want to let you know that we have muted all of the lines except for the presenters, and that's in order to make sure that the audio quality is excellent for everybody. So that's why we're asking you to submit your questions and comments by typing them in the box that you see there. Let's see, I want to say one more time that if for any reason your computer seems slow, like the visuals and the audio are out of sync or something like that, try closing down other applications on your computer, and that will probably do the trick. And finally, I wanted to let you know that this webinar is being recorded so that we can put it online on the CGS website, on our YouTube channel, and for anybody else who wants to embed it or link to it. Okay. Let me tell you a few words about CGS, the Center for Genetics and Society. Our mission is to work for responsible uses and effective societal governance of human genetic and reproductive technologies. And we're working toward this new biopolitics that I mentioned. And the values that we feel like we want to ground our approach in are these that you see: social justice, human rights, ecological integrity, the common good, and democratic governance. We do this in several ways. One approach is to make sure that we're working with the media to get this perspective across. So we are talking with reporters, we're publishing in outlets ranging from academic journals to daily newspapers, and we do have a full suite of newsletters, online resources that we hope you'll take advantage of. We also pay a lot of attention to network building. We try bringing together the scholars, the advocates, the policymakers, the artists, and others who are interested in these issues. And that's something that we have spent a lot of effort doing, and it's actually very gratifying because people who are interested in these issues have lots of interesting things to say. And finally, we are selectively active in public policy. We intervene at the state, national, and international levels as opportunities present themselves. So that's what we are, that's what we do. We'll send you some more information about these resources that we offer after this webinar, and we hope you'll take advantage of them, and we hope you'll keep in touch with us about your own work and your own thoughts about these topics. Okay, so now let me introduce our presenters today. And Alex and Corey, can I ask you to please start sharing your webcams so that we can see you as well? So that'll just take a minute. Hi, Alex. And?
Hello, I hope can you hear me?
Yes, great, okay. Welcome, Alex. Welcome, Corey. It's great to have you here. I'm gonna tell people a little bit about each of yourselves, and then we'll get started. So Alexandra Minna is a medical historian at the University of Michigan, where she's a professor of obstetrics and gynecology, American culture, and history. And her research focuses on the history of eugenics and uses and misuses of genetics in the United States and Latin America. She explores the dynamics of gender, sexuality, race, ethnicity, disability, social difference, and reproductive politics. Her 2005 book is called Eugenic Nation: Faults and Frontiers of Better Breeding in Modern America. And she examines this supposed science of better breeding in the American West. And that was really a breakthrough because most of the historiography of eugenics and history of eugenics had focused on other parts of the United States. Currently, Alex is leading a research team examining demographic and racial patterns in California's eugenic sterilization program. She's also written a more recent book called Telling Genes: The Story of Genetic Counseling in Modern America. So welcome, Alex.
Thank you.
And Corey G. Johnson is an investigative reporter who focuses on money and politics for the wonderful organizations California Watch and the Center for Investigative Reporting. His work has exposed secrecy, mismanagement, corruption, and abuse of power inside governmental, educational, and police organizations. And Corey was the lead reporter on an important CIR and an important and award-winning series for the Center for Investigative Reporting called On Shaky Grounds. And that investigation uncovered systematic weaknesses in earthquake protections at California public schools. So for those of you who aren't in California, you may know that that's a big concern for us. In July 2013, Corey published a report called Female Inmates Sterilized in California Prisons Without Approval. And this was an expose that we're going to be talking about a lot today, and a very important investigation. It prompted state lawmakers to call for a fast-track investigation into how unauthorized sterilizations were taking place in California prisons, and to call on the medical board in the state to recommend ways to ensure that this doesn't occur in the future. So Corey, welcome. Thank you both for being with us today.
Thank you for having me.
Well, we're really delighted. Okay, so let's get started on the conversation, and I want to remind people one more time, as we're talking, as the presenters, the three of us are talking, please feel free to type in your own comments and questions in the Q&A box, and we'll bring those into the conversation very soon. But let's start today kind of just giving the scope of what we're going to be doing. We're talking today about the long history of sterilization in California from the early 1900s, when our state, under an explicitly eugenics law, sterilized some 20,000 people. And that was happening from the early part of the century in large numbers into the 1950s. And then the law was only repealed in the 1970s. In the 1970s, in our state, there was a lawsuit brought to expose sterilizations that were being done not explicitly under the eugenics law, but in county hospitals, mostly on Latina women. And then in the 21st century, as we mentioned, and as Corey documented, we have now reports of very recent cases of unauthorized sterilizations and women prisoners in California. Women who were in prison in California were sterilized while they were giving birth. So Alex, you have spent a lot of time and are still spending time researching this in the historical archives in the state about sterilizations that were carried out under the explicit authority of state law. And Corey, your investigation was really about unauthorized sterilizations of prisoners, women prisoners in California. And I wanted to ask you each one at a time to start off the conversation by saying a bit about what motivated you originally to do this work, and what did you find out? Give us a kind of a summary, what you found out, and also about how you went about it, how you did the research. So I know that's a lot, but I wanted to just give you each a chance to lay out some of that stuff. So Alex, you want to go ahead?
Great. Good afternoon or good morning, wherever you're calling in from. In terms of doing the research, I published this book, Eugenic Nation, and one of my goals for that book was to understand why California was at the forefront of eugenics in the United States and also globally. As Marcy mentioned, up until that point, little attention had been paid to the leading role that California had played. And it seemed to me that there were certain dynamics at play, such as nativism, brands of racism in California, frontier ideologies and mentalities playing out on the ground, and the creation of a new type of professional class of educators, physicians, and so on, that all might be related to understanding this. One of the key components of getting at this was looking at sterilization in California. So there is this question, why did California perform 1/3 of all the sterilizations nationwide, more than twice the number of the second highest sterilizer, Virginia, and then North Carolina? So I really wanted to understand that. To do that required a lot of digging around in the archives, trying to find materials, some of which exist, some of which were very difficult to locate, and I'm still seeking to locate. And basically to, as you're doing this research, put all of these pieces in conversation and, coordinate them with one another. So I've done a lot of research in private university archives and public archives, and A little bit later, I can talk about the materials I'm working with, which encompass 15,000 of the sterilizations that were performed in the state. So really, the idea was to understand eugenic sterilization in the context of eugenics in California and the American West.
Great, thanks. Corey, can you take a crack at that same list of questions?
Yeah, well, for me, it started around March of 2012, and frankly, I kind of looked up on it. It was a lazy day on a Sunday. The TV was just blaring in the background. I had CNN on. Don't ask me why. I think I was waiting for, I think a basketball game to come on, and I was literally, kind of procrastinating on whether I should go buy some Clorox or not. So I was getting ready to head out the door when Anderson Cooper's show came on, and it segued into this report called Eugenics in America. And for me, I wasn't that familiar with eugenics or the eugenics history. It was something that wasn't taught me when I was coming through school. And so the piece was talking about just forced sterilizations in the early 1900s and the eugenics intent behind that. But what really struck me was California's role. When they ventured into California's role and talked about the 1/3 percentage where California led the nation in the number of forced sterilizations that took place, that really hit me as kind of odd and shocking. And then I think what really kind of got my curiosity juices flowing was when the CNN reporter went to Sacramento, and I'm based in Sacramento. She couldn't get any of the legislators to come on camera to talk about it. And, one of their aides finally came out and said, well, if we knew a little bit more about who some of these victims were, then maybe we could discuss it. But, and I just thought that was an odd response to something that, was done, decades ago. That I didn't see why there was a reason for them to be so leery about having a conversation about history. And so that told me, well, maybe I need to dig in a little deeper to understand a little bit more about this history. And so as I went about the process of literally trying to understand eugenics and sterilizations in the past, I got this tip that perhaps there had been more recent sterilizations that had taken place, and that those sterilizations may have taken place inside of the state prisons. And so that tip led me to a group, a prison rights group by the name of Justice Now, which is based in the Oakland area. And when I went there, the advocates there showed me a spreadsheet that was incomplete for the most part, but it was a spreadsheet of cost reimbursements that the state had made, where they had reimbursed doctors for performing these tubal ligations on women inmates at 2 different prisons. And so that documentation was an aha moment. It made me say, okay, well, maybe this tip isn't, as spooky or X-File-ish or as outrageous as I might have thought, because initially I would thought, well, who would still be sterilizing people, in 2006? Because that's ultimately what the tip said, that there had been sterilizations that had taken place, from 2006 upwards to 2010. And so that documentation kind of set me on a path that ultimately took me more of a year. It was incredibly difficult because in the state of California, and there's federal laws that strictly restrict, information that deals with patient medical care. And so then you couple that with the confidentiality around inmates and inmates information in this state. And so you couldn't, the things that you really needed to get to understand more, there was a legal reason for you not to have it. Then we bumped into the usual things that you bump into on on an investigative story where oftentimes the governmental agencies that you need to get the information from don't want you to have it because they think it may be embarrassing to them or put them in a very unfavorable light. So they fought me very, very hard on every request I made for information, even requests that had nothing to do with medical privacy or anything of that nature. And so it took a long time for me before I was able to finally get people, prisoners, prison officials, to start to tell me what happened. And ultimately what I eventually was able to publish that we got confirmed was that yes, indeed, from 2006 to 2010, right around 148 women have been sterilized in violation of the prison's rules that restrict tubal ligations and require them to get this special approval in order to be done. That the officials involved told me directly that they knew about the rule but chose to disregard it and do these surgeries anyway. And the head OBGYN at the prison where a lot of these procedures were done, most of them were being done, when I interviewed him to ask him why and to ask him about the cost, he said, well, in comparison, that cost is minimum when you look at how much you save the state of California in welfare from these women if they continue to have these unwanted children. And so that response and other things that we were able to find out in the story, where they consciously had a workaround to that other medical experts said was not medically sound at all. Those were the big findings out of that story that ultimately led the legislature to get concerned and caused a lot of people to be outraged and want to know a little bit more about what's happening.
It really is a shocking story, and even I think for people who are familiar with the history of eugenics and with some of the current practices that evoke eugenics. So it is an amazing story. One thing that strikes me is that the story that you've uncovered, Corey, and the stories that you've uncovered in the archives, Alex, are separated by, as much as 100 years. And I wanted to ask, again, each of you, what you see as the similarities and what you see as the differences between these two sets of abuses. Let's go back to you, Alex.
Well, I think when I learned about the prison sterilizations, I was shocked, but only for a few seconds, because what fell into, what kind of began to make, what I began to see in terms of as being a historian was a longer trajectory of sterilization abuse related to, enacted on vulnerable populations, and often in conjunction with longer histories of institutionalization. So I think that you can't divorce the whole history of institutionalization and incarceration to this history of sterilization abuse. Also, there are ways in which there are three episodes that we're talking about. There's the decades-long sterilizations that occurred in the state institutions, right, from 1909. Really, they slowed down dramatically in the 1950s, but they didn't end until 1979 when the law was repealed. The law is repealed because of awareness of another episode of sterilization abuse that is taking place in these clinics. Then revelations about that helped to basically codify the very safeguards and laws that were supposed to be in place to impede the kinds of abuses that happened in the state prisons. So, but obviously they didn't. So there's a way in which there's this longer history of lack of oversight and devaluing of the reproductive lives of increasingly by the second half of the 20th century and into the contemporary era, the lives of women, but also the lives of men, because many men were sterilized in the first half of the 20th century in California. So the themes that I really see are this longer history of institutionalization, this ongoing issue with problems with lack of oversight, and things falling through the cracks in terms of regulation, and then whose lives are being valued as reproductive people, as citizens, as potential parents, and so all those themes, and then also the theme that Corey raised of cost savings. I was actually just looking before I came into this webinar at an image that was not about sterilization, but it was about the same department in California that oversaw sterilizations, the Department of Institutions. Another unit they had under their purview in the first half of the 20th century was something called the Deportation Agent. And what that did, that agent would round up non-native, basically often mainly Mexicans and Filipinos, and would deport them and basically kept a tally, a list of how much money had been saved and how much welfare expenses had been saved. So it's that same type of logic of who was a burden to the state, and therefore whose reproductive capacity needs to be controlled, or whose very presence, in the state needs to be controlled.
That's so interesting, and actually we have a question from one of the participants, and I guess this one is for you, Corey. Really, was this savings on social services, savings on the cost of social services, was that actually the official reasoning of the prison officials?
That's a great question. That wasn't the official reasoning that was given to me, but cost was in the conversation. The official reason was that they saw themselves as giving the inmates a service that any other woman could get on the outside. So the argument that they raised with me was, if you're not incarcerated, you have the right to get this procedure, and we didn't think it was fair that these women had to be treated unequally from their counterparts on the outside. And so they saw themselves as being progressive. They saw themselves as, even though there might be a cost for breaking this rule, we can feel good because we were giving the women a vital service that they wanted and needed. That was the official explanation that was shared with me. Now, having said that, cost was something that was also told to me by the prison officials on the record and off the record, where there was this perception that there was pregnant women, or some women were gaming the system, that would because of their lives and their various struggles out in the community, they might couldn't afford to have premium or decent health care. But if they committed a low-level crime and got sent to prison, then they could have the state take care of that for them. And so there was this perception, we don't know if it's accurate or not, but it was repeated many, many times to me, that these women were costing the state a lot of money. And so why not give them this service that could help them and also cut down costs from the state? They never specifically said social service, or anything that, but it was just cutting down the cost from the state. And to me, that was the very fascinating parallel from what took place in the 1900s. Because once I heard that, and I started seeing and actually reviewing some of Alex's work, where she thoroughly documented that the early eugenics leaders in California, they also saw themselves as progressive. They also touted the eugenics movement as something that would cut down costs, unneeded costs from the state. So to see the current day officials kind of parroting the early day officials with the same reasonings and rationales was an aha moment to me that, maybe there was something really significant taking place here. And that perhaps maybe there was a history that was being forgotten or had been forgotten in the state.
Yeah, well, on that note, I'll mention that there's been a lot of interest in the last couple of years about the history of eugenics, more so than in previous times. And, as you mentioned, Corey, you grew up, went through school without hearing about the history of eugenics. That was certainly the case for me. And when CGS in the beginning of the 2000s tried to bring some of this history to light, we didn't feel like there was much uptake. But in the last 2-3 years, and I think perhaps in part because of the situation in North Carolina, where there were not just official apologies, which have happened in a few states, but also a move that resulted in legislation for reparations for people who were sterilized under state eugenic laws, because their laws were in effect later than in California. So there are people alive that suffered from that. That news seemed to have, and maybe other things, and it'd be interesting to talk about that, really sparked an interest. And on our end, a couple of the outcomes were 2 events that I'll mention, because we have a lot of information about them on the CGS website. And Alex was part of the organizing committee along with some other people that worked on these 2 events. One was in the summer of 2012, an event at UC Berkeley called Eugenics in California, and we had a great set of speakers, including someone from Justice Now, the prisoners' rights organization that you referred to, Corey. And then just a couple weeks ago at San Francisco State University, we had an event called Future Past, Disability, Eugenics, and Brave New Worlds that we were oversubscribed 5 weeks before the event because there was such strong interest in it. So I think these things are finally, now more coming to light or starting to come to light. I want to, acknowledge both of you as part of the reason that that's happening as well. But I also want to go back to, Corey, what you're saying and bring in some of the questions from people that are starting to come in here. One person asks about this situation in the prisons. Did the women who were sterilized, ask, the prison officials said that they were providing a service that was available to women outside the prison. But did the women themselves ask for the procedures to be done in there?
The way we understand it, and I'm a couch this with, our sample is still relatively small. So certainly we can't say this is representative of every case because we simply don't know. But in the women that we've been able to talk with and the people who worked in that area, the process would be that the doctors would ask the women, would say to them or suggest to them, hey, look, if you're pregnant, if at your age or whatever, if you continue to have babies, you could die. You're at high risk for uterine rupture or possibly death, and we think you need to have this procedure. And so couched in that kind of context, many of the women who consented, would legitimately feel that it was in their interest to consent. And when they did consent, the forms would then be written in such a way that would clarify, would say that the inmate wants the procedure. Well, the inmate consents to the procedure, but it was almost being presented in certain cases like they were requesting it, when in many cases they were accepting the doctor's recommendation based upon this fear that they could die. And when we tested that, we asked the doctor, and he said, well, I only did that with women who had 3 or more C-sections. But when we talked to an outside expert, she said, well, even if you had multiple C-sections, that's not a guarantee that you're going to die. And if you had a baby, there are people who have 5, 6, 7 C-sections and ultimately have no problem. So yes, it does mean that the risk of rupture is higher. He said, but in order to deal with that risk, it's appropriate to offer women reversible forms of birth control, like an IUD or something like that. You wouldn't just say, hey, we need to sterilize you, as a way of mitigating that risk. And so then we bumped into women who didn't have 3 or more C-sections. We bumped into women who had only had 1 C-section or no C-sections. And the doctors were still, heavily suggesting to them that they need to get sterilized. So this was the context under which at least the women that we've talked to were being asked, and at least 1 or 2 who consented under this context. I mean, one of the women told us, and I said, well, did the doctors ever explain to you why they felt it was so strongly that you need to get a tubal ligation? And she said, no, they never told me of any medical risk. They never told me that I could die. They just said, you need to have this done. And when I asked questions, they wouldn't answer the questions. And I said, well, that didn't bother you? That didn't raise a red flag that maybe you shouldn't do it? And she said, well, it was prison, so I figured that was the best kind of doctor you was going to get. But I didn't think to question it. And that was the other dynamic, that some of these women are really dealing with substance abuse issues. They're dealing with, they're coming from really sparse educational background. And so some of them may not be as savvy or may not culturally feel acceptable that they could challenge a doctor without there being some strong repercussions. So that's the other piece to that puzzle of what was happening with those procedures there. I mean, I don't want to make it seem like every woman didn't feel like this was a good thing. We bumped into women who said, yes, I agreed, and I thought it was a good thing. But there were other women who clearly felt like they were pressured and coerced into it, including one woman who said that she was on the operating room table and was approached to get the procedure done, even though she had refused this procedure twice, once at the prison and once also, in the hospital. And so it's a tricky thing of what was going on, but at least from what we've been able to see, it doesn't seem like it's square to what the norm was on how these sterilizations are supposed to be offered to women. And I think that was the really important thing about the story that a lot of people have grasped.
Right. Well, I want to give the two of you a little chance to ask each other questions. So, Alex, do you want to start off on that?
Well, one thing I'm curious about is the status of the investigation and the audit that's been ordered, and how you see that playing out in terms of, when you talked previously, you tried to talk to some folks in the Senate or the legislature, and they weren't necessarily that interested. Or Marcy, you were talking about that earlier in the early 2000s. But now, you have this Senate committee which has, called together this hearing and was pretty emphatic about, we need to get to the bottom of this. So I'm wondering where you see that legislative action going, and what the timetable for that is as well too, so we can all keep track of it.
Sure. The timetable that we've heard is that the auditor's report is going to come out sometime in April of next year. It's not clear on when the medical board's review is going to be completed. Their stuff is completely shrouded in secrecy, but the auditor's report is going to come out, in April or sometime shortly thereafter. And right now it's a mixed bag. It's hard to say how it's going to turn out. It really depends on the level of resources and thoroughness that the auditors decide to bring to it. When someone says they were coerced, that by definition is a very tricky thing to investigate, because investigators tend to want to look for records and things that would support that, but I worry that because of the time gap and because of where they would have to get these records from, the providers, the hospitals, and the like, that there may not be records that an investigator can readily grab that could easily substantiate a claim of coercion. And so that might be one issue that pops up in this review. The other issue is scope. The data that we obtained finally showed that these procedures had been taking place at least as early as 1997. But the legislature decided to limit the scope to 2006 to 2010. Well, if you do that, you don't get a chance to really answer the questions of why were these procedures started and taking place to begin with. So that's another area of concern that perhaps, and we don't know if that's being altered or not, but if it doesn't get altered, we could end up with a report that doesn't give us the full picture of what was happening with these procedures. So that's what we know as of right now. That's basically a long-winded way of saying not much, but there are a couple of things that I think we need to be mindful of, and hopefully that they'll resolve themselves through the investigative process.
Thanks. We're going to give the two of you a 2-minute break now because there are a couple of things that we wanted to call to the attention of the participants. And we've got a lot of good questions coming in, so this is going to be a very short break. But I did want to let you know, and let's see, Jessica or Charles, can you? Thank you. I wanted to let you know a little bit more about some of the resources that we have that we want to let make available to you and call to your attention. So on this slide here, you see some links to Alex's work. This is the book that she was talking about, and her book about genetic counseling in America, and her current research, which I hope we have such a short time. I hope we'll get a chance to say a few words about that, Alex. And Corey is with the Center for Investigative Reporting, as I mentioned, and you can see his work there. And we are giving a link here to the story that we've been talking about, which there's so many questions connected to. We also wanted to call your attention to some specific things on the Center for Genetics and Society website. We compile news story, opinion pieces, blog posts into sections by topic on our website. And there's any number of sections actually that are touched on by the things we've been talking about today, but we particularly wanted to call your attention to a section on disability and human biotechnologies. I hope we'll be able to say at least a few words about disability rights and current eugenic concerns. We have a section about eugenics, which does have a lot of the historical information, a section about reproductive justice, health, and rights, and then a section about enhancement and transhumanism, which is, I guess, a little bit more indirectly connected with eugenics. I feel like we could have this conversation go through each of these topics, but we'd be here for much longer than we have. We also wanted to ask you if you can contribute to help us with our work, to do so, and we'll be sending you a link that looks like the one you see on the line, on the screen afterwards. And we wanted to just briefly let you know that we do have this very robust website with lots and lots of information, a blog that we post weekly, a couple times weekly, new posts on. We compile our commentary and news in a newsletter that can come to you in your inbox, and it's just every other week. It's a really good way of staying on top of these issues. And we also do social media, so Twitter, Facebook, Google, and YouTube. So let's see, that's really all I wanted to say, and I wanted to go back and put to you some of the questions that some of the participants are asking. So this is a question for both of you. The question is from Tim Ropke, and he asks, in your research, did you get any ideas about how these so-called progressives throughout our California history felt they were doing the socially correct thing when they saw the overwhelming number of women of color being sterilized, and in earlier days, not just women but men. Alex, do you want to start on that?
Well, I think a few things. The first is that part of this progressivism is one important component of it that we can see coursing throughout all of these stories is a very strong dose of medical paternalism or social paternalism. You know, we know we're the experts, we know what's best. So that was part and parcel of every single episode we talked about in terms of sterilization abuse. But there was also an idea that progressives wanted to, you know, their idea was to reform society for the better, to achieve progress, as the word states, and to apply science, which we today would probably, you know, call pseudoscience, but at the time it, you know, was the science of the day, to enhance things to make them better in the state of California, kind of to create their own utopian frontier society. I think you can't see it outside of the context of paternalism and also, you know, social control. So it was that version of progressivism. Another thing I think that I don't want to leave out of the conversation, especially when we're talking about 20th century eugenic sterilization. So I've been doing research with the team, and we've been mining this data, 15,000 records, to understand some of the demographic patterns. When you look at that in aggregate, what you see is that particularly Spanish surnamed patients and inmates at all different types of institutions were sterilized at elevated rates. So there was a racial bias in California's sterilization program. No eugenic sterilization law, as Troy Duster pointed out at a conference we were involved in a few weeks ago, was ever explicitly targeting one particular race. But the way it played out and the way they were implemented had racial inflections and biases, whether it was in California or North Carolina. But another important component of that is that those who were sterilized in the 20th century were those who were classified as unfit. And often that included people with disabilities and people with perceived disabilities, often intellectual disabilities. So I think that's an important part of the story. And Marcy, you were asking, why is there more interest now? You know, why is this issue gaining traction? I think because people are concerned about issues of state abuses. I think there's a lot more awareness of the human toll that hyper-incarceration is taking on this country and in the state of California. But there's also, I think, a lot of anxiety about what does the rollout of new reproductive and genetic technologies mean for us? And what does it say about our values? And what does it say about our choices or the constrained context in which we are able to make those choices? So the disability issue, that holds, you know, kind of remains steady from the early 20th century to today. And I see that some of the questions that have come through relate to termination of pregnancies and people, you know, the ability to diagnose Down syndrome in a fetus and so on and so forth. And though someone had asked if cost was a logic in that, cost was always a logic in that. When amniocentesis was rolled out in the 1970s, it was because of disease prevention, it was because of cost savings, and it was because of eugenic rationales of, you know, what kinds of babies do normal families want to have. Those are still very much with us. So I think that that is distinct from what we're talking about in terms of the abuses in the prisons, but I think that we can definitely connect the dots between them. And I think we are living through a moment of great anxiety about what do all these technologies mean for us. And as we know, the United States is unique in that we have very little regulation of reproductive and genetic technologies. So everything is swirling around in this increasingly commercialized marketplace, and none of us have much control over it. So I think that creates a context when people want to understand more, people want to know more, and so on.
I want to ask Alex just two quick questions if I could. I mean, for me, if the Duke game had been on, I probably would have missed my inspiration to dig into this topic. So I'm curious on what initially inspired or drove you, Alex, to want to focus your scholarship on this topic. I mean, because you could I would imagine there's a ton of things for you to look into and want to study in the medical field. What drew you to, sterilization and eugenics initially?
Well, thanks for your question, Corey. I have to admit, when I started writing the book Eugenic, that became a Eugenic Nation, I actually didn't want to look at sterilization because sterilization is one of the aspects of eugenics. It hadn't received nearly enough attention as it should, but it still had received a lot of attention, was always at the centerpiece of talking about eugenics. So when I started researching that book, I actually wanted to look at other aspects of eugenics in California and in the US. And so what I examined, for example, are relationships between eugenic racism and the early environmental movement, between eugenics and immigration control, between eugenics and IQ testing. I was really interested in filling out the panorama so we could understand the different ways in which these ideas of better breeding played out in these different social domains of progressivism, as someone mentioned in their comments. But then, nonetheless, I couldn't really, it was the elephant in the room, right? And because California had been at the forefront, and I did address it in my book, but then I realized that I'm happy I made the decision not to focus on sterilization to start with, because I think it allows me to put that in a much bigger context and to realize the extensiveness of the eugenics movement. On the other hand, once I started kind of maybe getting over some of my own kind of preconceptions or myths that were in the historiography about what sterilization was and digging into the records, I started uncovering many different things that I now want to explore more fully. So, as I mentioned before, working with this data set, one of the things we want to do is to show demographic patterns around diagnosis. What were the top sending counties when it came to who was sterilized, what institution were they sent to? And then, what these sterilization orders are, they are kind of bogus consent forms is what they were. They were forms that had to be signed off by someone to be sent to Sacramento so they could be filed away in microfilm 30 years later. And luckily I was able to digitize them. But the point is that, they required some kind, it was some kind of a process, right? For the sterilizations to go ahead and for a surgeon to actually perform them. But the other thing about these records, and this is one of the things that's really frustrating about California, is that we know so little about the people who were sterilized in the era of state eugenics. We have a few stories here and there of people who've come forward. There are a few things that were captured by psychologists who were looking into institutions in the 70s and 80s, but we know so little about who these people were, what their experiences were, and they share something. I mean, Corey, you were talking about how female prisoners, have difficult histories and come into institutions with a variety of baggage. Well, it's the same for many of the people who ended up in a place like the Sonoma home. Sterilization was one of several or many bad things that happened to them along the way. But to understand how did they get there, and what were their stories, and you find very compelling stories, particularly with the Mexican origin inmates and patients, about migration and disruption following the Mexican Revolution. So I'd become compelled to both understand the much bigger, broader patterns, demographic patterns, but also because we know so little about these 20,000 people to recover their experiences and the voices to the extent that we can with this limited documentation. So that's a kind of sense of restoring some dignity to people who were wronged in the past. So I view that as kind of a history in the service of social justice in terms of memory itself.
And I definitely want to let other people get their questions in. I guess my last question would be, what was your biggest surprise thus far in the research? What did you discover that totally kind of took you aback, or you just weren't expecting to see it?
Well, I think there are two things. One is, and this comes from looking at other states as well, but how young some of the people sterilized were. So we're talking about people as young as 7. So we're really talking about abuse of minors in a very serious way, girls who were 11, things like that. So that's one thing that I still find quite jarring and difficult to think about. That's one aspect. And another aspect is that, looking more into these records, and this is working with a graduate student here at the University of Michigan, we found that Mexican parents were pretty active in resisting sterilizations of their kids. And they were vocal, they protested, they enlisted the help of the Mexican consul. They found pro bono lawyers. They got the Catholic Church involved. And so there was this earlier history of what I would call Mexican American civil rights activism around institutional control and reproductive abuse that's been completely forgotten because it's not in any of the history books. It's not really even in Mexican American history. And part of that's because, as you mentioned, Corey, getting a hold of these documents requires a whole variety of steps. So I'm only looking at these with the approval of the California Office of Human Subject Protections. They must be redacted. They must be de-identified, et cetera, et cetera. So even just finding them and getting access to them, it's not like you just walk into an archive and put in a call slip and the next minute you're looking at a file. This takes months, if not years, to actually get to the documentation so you can look at it. But yeah, those two things, how young some of the victims were, and then also this hidden history of resistance, particularly among Mexican American parents.
Wow. Well, there's so many questions actually coming in, but here's one that I think we probably will end on. So maybe both of you could just say a few words about what are some of the remaining unanswered and outstanding questions, and what are your plans for the future? Corey, do you want to take a crack at that?
Well, for me, I'm still digging, trying to understand a little bit more about some of the doctors who were doing these procedures, some of the women who received them, and still trying to get at the why. We haven't really gotten good answers to the why, so we're still spending a lot of time trying to get at that. Hopefully, we'll have something out, a newer piece in a few weeks that will give you a little bit more light into one of the key doctors involved. So be on the lookout for that.
Great.
I think that segues into an important point, which is looking at these abuses, who is responsible for them, and where do we kind of lay the blame? Or if we're thinking about issues of accountability, how do we understand that in a way that actually would be helpful in terms of preventing such abuses in the future? And we often talk about, the state passed the eugenics law, the state implemented it, but also it was physicians, as Corey's looked into, who are performing these surgeries. So where does their responsibility rest? And, that's something that hasn't been talked about enough in this whole history. And the physicians were often, very much of the progressives who were politically involved in advocating for sterilizations at the same time that they were performing them, in accordance with the kind of medical paternalism I talked about before. So thinking about that historically, I think, is really useful as well, not to slam, all obstetricians who worked for the state in the 20th century, but to understand what factors allowed for that type of rationale to reign, and to hold to such an extent that they could carry out what was obvious violation of informed consent.
Right. Well, there's so many unanswered questions immediately from our participants, but also in this general field, there's a lot of work left to do, not just research, but I think also the kind of, correcting the historical record and memory and righting the wrongs and being on the lookout for current technologies that have these eugenic overtones as well. But we're going to have to leave it there, and I want to thank both of you. This has really been a fascinating conversation, and I hope participants, you all enjoyed it as much as I did. We will be sending everybody who participated the information that we showed you real quickly online, and we hope you'll stay in touch. So thank you, Alex, and thank you, Corey, one more time, and thank you, everybody, for joining us.
Yeah, thank you. Thank you, everyone, for calling in.